CapeTalk, the South African Depression and Anxiety Group, SADAG, recently put out the results of its most recent survey. And the picture it paints of South Africa's perception of mental health is not a pretty one. We're joined now on the phone by Dr Bronwyn Dworzanowski-Venter, a senior research associate at the University of Johannesburg, lead investigator in this particular research survey. Bronwyn, good morning. Thank you for getting up so early to talk to us.
Good morning, John. Happy to be with you all.
How empirically reliable are surveys? Because they speak to what people feel, but when you're talking about feelings, what people feel is the most important thing. There's no sort of objective indicator.
Wow, that's such a great question and quite a challenging one early on a Monday morning, so I'll try to keep my answers short and sharp. I think the thing about surveys is we just need to make sure that we validate them. So in our survey, for example, we asked people if they were professionally diagnosed with a mental health condition. So our statistic at 52% that people in our survey are not feeling good and are actually being challenged is professionally verified by a medical diagnosis. Then we popped in a scale to sort of see how are people feeling right now. And, when we took a look at our psychological distress scale and we took a look at the professional diagnostics, they matched. So I always think when we deal with people and we do surveys, it's good because we get a lot of people very quickly. But as you point out, we can't get that in-depth work unless we're very clever in terms of how we ask the questions. And I'm not saying we were clever, but I think we did try to have some basis in their lived reality.
So when a lot of people tell you and paint a picture of unprecedented stress, emotional strain as a result primarily of some kind of combination of financial pressure and job insecurity, that is not people just kind of venting because they have an opportunity to vent. It reflects an underlying picture of profound concern.
Absolutely, it does. And I should imagine that, when we think about what the remedies are for that kind of concern, we saw in a Gallup poll in the United States of America that 88% of workers reported feeling quite stressed. Then we sort of saw the same thing occurring in the United Kingdom. But here in South Africa, there's a hammer and anvil effect, which is really important for us to consider. So we don't have the option here with our high rate of unemployment. We don't have the option of the great resignation to sort of show the workplace, to show employers that we're not happy, that we're struggling. And so I think what happens is that because of our immense financial pressure, now the whole world is struggling with inflation. But I think for us, it's quite a different picture because we do have fewer opportunities. 38% of the people in my study were really worried about losing their jobs, and yet 61% wished that they could afford to quit. So it's definitely something for us to consider, that hammer and anvil of not being happy, being super stressed, but at the same time the high unemployment rate, limiting our options for doing something about it.
And you asked the question, have you been diagnosed? And that's part of trying to understand the survey. But my sense in South Africa is that very few people have been diagnosed because very few people have the money, have the opportunity, have that thing in their lives that creates a path from their mental distress to a mental health practitioner who can diagnose and help resolve.
Yes, I think you're absolutely right. I think that the ratio, I don't have it at my fingertips now, but the ratio of mental health professional to ordinary South African is immense. So we see very few qualified psychiatrists, for example, in the medical population, and then we see a high incidence of what we assume to be stress-related conditions. But of course, as you point out, they're not always so readily diagnosed. So I think that that's true. On the other hand, I think that our sample, because we only chose to talk to people who are currently employed, painted a slightly different picture because there's this assumption that people who are employed perhaps have greater access. And it's not a bad assumption. But, when I think about it, fewer than 50%, just below 50% of the people that we talked to who were fortunate enough to be employed had employee assistance programs at work. And we did see an alarming trend, even in this privileged or relatively privileged sample of people, not being able to access mental health services at work. So I suppose that finding also then, John, underlines your astute point.
Yeah. So I'm lucky in that the company that I work for takes mental health, mental wellness very seriously. And there are lots of programs, lots of opportunities to engage with professionals, lots of interventions to try and create an atmosphere which is less stressed. But I think that is probably a minority experience, that most companies either don't know enough to care enough to do something, or they don't feel they have the resources to make this kind of intervention.
I think you're absolutely right. I think that in terms of, the post-COVID reality, lots of things are being defunded. And, it could be something quite simple. So, for example, we didn't just talk to private sector workers. We talked to people in the government departments as well. And one of them was sort of saying, we used to have a small gym next door to my office and it's been closed down. So it's not that it just has to be a psychologist or a social worker or a psychiatrist on staff. Sometimes these sort of extra recognitions that people might be stressed and might need to blow off a little bit of steam are really important. I think broadly speaking, that in our sample, 2 out of every 3 employees was compelled back to work after COVID. And it's not to say that people shouldn't go back to work, but that a lot of employers were saying, we've got employee assistance programs, but we just work constantly and we don't have time to use that. And, what's really, really interesting to me was that 75% of the people in our sample said, we just can't switch off. There's this constant stream of communication. So even though companies might not have the funds to keep their EAPs going, it might also just be that, if we can get two-way communication going and let people go on leave when they're supposed to be on leave and reduce the after-hours communication, these are cost-effective ways of reducing workplace stress.
Thank you very much to Dr Bronwyn Dworzanowski-Venter of the University of Johannesburg. A couple of countries, Australia most recently, have passed the right to switch off legislation, giving you the right as an employee to not respond to employer communication after hours.